since these drugs have been released and since the price has come into question, there's been a lot of discussion about who should be treated. So I think that this discussion is not really valid in terms of the approach to the patient. I mean, let's look at it. If you want to treat somebody with high blood pressure, do you wait till the kidneys fail before you start treating them, or do you treat them in anticipation? Now, you can argue, well, not everybody with high blood pressure is going to get kidney failure, but a significant number of people are, and you can't pick out which ones they are, so you better start treating them now, and that in the long run is going to save you money. So I think the same thing applies here. I think that people with hepatitis C should be treated at the time of the diagnosis. People that have more advanced disease are much more difficult to cure, and also as the disease progresses, then the expenses of taking care of these patients increase in terms of doctor's visit.
There is always going to be some contraindications, although the number of contraindications is getting very narrow now. And that means that indeed many patients and the majority of patients should be treated. I think as a general kind of approach to a patient with hepatitis C infection should be that we should treat. Everyone deserves to be treated, particularly because we know that the treatments that we offer should result in clearance of the virus, which means that it's a lifelong, essentially, living without hepatitis C anymore. In terms of, if somebody who didn't know about their hepatitis C infection until a year ago, and now they are aware and waiting for the new drug, do they need to be treated today or 2 months from now or a year from now? It probably doesn't make that much of a difference. What we know from the previous sort of strategies, for example, with the old interferon ribavirin treatment, that waiting a few years in patients with chronic infection and no evidence of liver damage in terms of fibrosis, then probably waiting a few months or even a year would not necessarily be harmful. But as a general rule, I think the virus should be eradicated. There could be some patient populations where treatment is more urgent, and I think those would be the ones who have any evidence of advanced liver fibrosis or cirrhosis, and some special populations who probably need treatment as soon as possible.
In an ideal world, we should treat everybody. Anybody who has progressive form of chronic liver disease should be treated, particularly when treatments are safe, highly effective. The complexity of that question is driven by cost.
The kind of timing of the treatment should be a discussion between the patient and their physicians. And I think as physicians can tell our patients that if somebody had a recent infection, more than a year being infected, because the acute hepatitis C infection actually still can resolve on its own in about 20-30% of the cases. So, we typically wait like 6 months after an acute infection to establish the chronic infection before anyone would be eligible for treatment. But in chronically infected individuals, then it really is a discussion between the patient and the physician in terms of, are there any particular side effects or kind of extra hepatic manifestations, for example, of hepatitis C that would warrant a very quick action and an early treatment as opposed to potentially waiting a little longer. In terms of, this big flood of patients potentially coming in and how is that going to affect cost and particularly insurance companies, that is something that, it is beyond the individual physician's decision, I think.
I mean, I have patients in our practice that we've been following for 20 years with hepatitis C. Yes, that particularly, aside from, this is the ones that didn't die. They're the ones that are still alive. You can say, well, here they are 20 years later and they're still alive. Meanwhile, they've been coming to the doctor every 2 or 3 months to get their blood checked and make sure they've been getting scans of their liver and all sorts of expenses. So again, it's very short-sighted to start warehousing patients. There was a reason to warehouse patients when the medications were injurious, difficult to take, and not very successful and had a high side effect profile. But right now, it makes no sense to me to warehouse patients. And again, it comes down to the insurance companies, Medicaid and Medicare, refiguring how they allot their money.